I used to be an executive of one of the country's biggest health insurance companies. I was, frankly, the lead propagandist for the company and for the industry. The campaigns that we created were based on FUD, fear, uncertainty, and doubt. And the whole idea of these campaigns is to get people to fear change that's being proposed, to feel uncertain about it, and to doubt that those who are proposing it are really on our side. They want to scare us into thinking that what's being proposed would somehow cost too much or lead to rationing of care or long waits for care, none of which is true. But when you say this over and over again in a very compelling way, you get people to believe it. We would bring candidates into our corporate offices for a private lunch or reception or dinner, and the expectation of the candidate would be that campaign checks would be written. A young 17-year-old girl in Los Angeles needed a liver transplant. Her name was Nataline Sarkeesian. A perfect match had been found. The family came to the hospital not long before Christmas. They were there waiting for the transplant to be done, and her surgeon said that they felt that with the transplant she would have at least a chance of surviving. There was a Cigna medical director who said no, he didn't think that transplant was medically appropriate for this young woman. As a result of that, they couldn't go forward with the transplant. The liver had to go to somebody else. The mother told me later, she said, "What does Cigna have to do with this?" She learned, as so many people have learned, that insurance companies have a big role to play in whether or not you get the care that your doctor says you need. They decided they would appeal that denial to no avail. They decided to go to the media. It became a big PR problem for Cigna. I was on the front lines of trying to defend the company. And because of all the publicity, the company decided to reverse that denial and approve the transplant. Unfortunately, so much time had passed since the original request was made that she had gotten sicker. Some of her other organs were beginning to shut down. And after Cigna said it would pay for the transplant, Nataline died just days before Christmas in 2007. It frankly just broke my heart. I came to realize that the job that I was doing was perpetuating a system that was very unfair, dysfunctional, and expensive. I just felt so ashamed of what I was doing for a living. I ultimately decided I couldn't live with myself, so I left and became a very vocal critic of the industry. When you have people who have insurance who are turning to GoFundMe to beg for money to be able to cover their out-of-pocket expenses or to cover a treatment that some insurance company bureaucrat has said, no, we're not going to pay for. When you have that going on, you have all the evidence you need that this system doesn't work.